Yeah, we are all welcome.
Yeah.
Hi, good afternoon. You are warmly welcome to this month edition of Time with a Dietitian. I'm Nana Fakuma and I'll be the moderator for today's discussion. I believe we have learnt a lot over the months, particularly this year, and this month wouldn't be a minimum experience. We are going to learn a lot from this month's edition. We thank God so much for today. We thank God for our lives and bringing us all together. Before we start, you might want to put the flyer on your status. You might want to invite someone. You might want to share it on your department page, on your any WhatsApp platform you are on. Just invite someone for today's discussion. I believe we will all leave here being well informed as to the next steps to take in concerning our nutritional health. Last month, I believe we learned something or two. So before we move on to this month, maybe I would want two people to just unmute and share with us what they learned last month before we move on to today's discussion. Thank you. Anybody to unmute to share what they learned last month? Hello. Oh, so none of us were here last month. Okay, so last month we discussed nutrition and stress. And our theme for the Wellness Center this year is on reducing work-based stress. And last month was just something in line with our theme. And we learned a lot. Since nobody is willing to share, please, you have to bribe me before I share something. Right. So today,
We even captured some of the
mhm,
tips in the
mhm,
wellness
mhm.
newsletter. So it's
Okay.
either we don't read.
Hmm. Right, Prof. Thank you very much. Thank you very much. So please let's be looking out for all these things. And we also send recordings of our monthly meetings on our YouTube page. So please follow us, KNUST Wellness Center. Please like and follow us on YouTube, on Instagram. Even if you miss a particular month's discussion, you can go back on our YouTube page and watch the full recording on our page. So we are providing the information as easy as we can, and it is up to us to learn one or two to help ourselves, our family, and people around us. So let's take the opportunity given to us, because seeing a dietitian is not cheap, it's expensive. So we are providing all these things at our way at we are making it available to us for kind courtesy of the Wellness Center. So so please let's make good use of this opportunity to better our lives. Right. Thank you so much for joining once again. And I believe our numbers we are good to go for today's discussion. Thank you for joining once again. Today our discussion is on nutrition and kidney health. Nutrition and kidney health. And when we mention kidney health in Ghana, somewhere last year, we all heard of the issues arising from dialysis centers being shut down because they don't have the necessary equipment to cater for the patients complaining about the dialysis cost and a whole lot of issues, the dialysis cost being increased. But thankfully this year, I believe the issues relating to dialysis has been resolved in a way. The government has even rolled up measures to reduce the cost of dialysis. I think children below 80 years, their dialysis services are free now. So the government is making an effort in reducing the burden on the patients. But then that is solely not enough. What we are coming to discuss here is in an attempt to prevent us from even getting there, so the government doesn't have to spend another money trying to reduce the cost of the dialysis for us. So this afternoon's meeting is very, very important because kidney health is something that is costly. It's very costly. Treating kidney diseases is costly, and we can mitigate all these things by learning a few tips today that will help us. So please, let's take our notebooks, our pen, let's open our ears, let's be ready. If you have any questions, you can write it down. And I'm just hoping that by the end of today's discussion, we will really learn about our kidneys and how nutrition can help us in that regard. So this afternoon, we have a resource person in our midst to take us through today's topic. And he is a registered dietitian, of course. Registered dietitians, it's not easy to be a registered dietitian. So if you have the title as a registered dietitian, then you really need to be fully acknowledged. So this dietitian had his bachelor's degree at the University of Health and Allied Sciences with he has an extensive clinical and research experience, and he's currently working at the Maternal and Child Health Hospital at Pampaso. He had his national service at Konfanochi Teaching Hospital, and his career goal is to advance dietetics and nutrition through providing innovative solutions for individuals with nutrition-related problems and combining nutritional science with information technology. And his professional experience includes developing therapeutic diets for patients with chronic conditions like kidney disease that we are about discussing this afternoon, and also educating the public through media and creating digital platforms for health education. So this afternoon, I believe that our resource person is in the best position to handle today's discussion. And he is in the person of RD Isaac Ano. RD Isaac Ano. Hello, RD.
Hello.
Hello, you are most welcome. Most welcome, and the floor is yours. Please, you can start. Thank you very much.
Okay, thank you too. So give me a minute for me to share my slides.
Yes, please.
So how we can see my slides now?
Yes, please, we can.
So good afternoon, everyone. I am Isaac Ejiano, dietitian, as you have said earlier, and I'm very grateful for giving me this opportunity to talk to you. So today I'm going to discuss about kidney health and how nutrition is related to kidney health. So this will be my outline of my presentation. So I'm going to introduce you to how the kidney functions and its importance to the body. And we're going to talk about the nutrition needs for kidney health. Then talk about something about the dietary recommendation. And I know some people join because they have kidney issues. Others still join because they want to prevent themselves from getting kidney problems. So it's going to be in 2 sessions. If you have kidney issues, you're going to benefit from this presentation, as well as if you don't have kidney issues. I want to have tips that you can use to prevent yourself from getting a kidney condition. Okay, so when you talk about the kidney, it's one of the organs in the body that removes toxins and wasteful products from the body. So let's say you have taken a car, you are going home, you buy an energy drink, or maybe you are on medication. Definitely, there's an amount of toxicity in that medication or in that bad food that you are taking. So definitely, there has to be a mechanism in the body that has to take away that filth from the body. So the kidney is one of the organs that is very good at performing this task. So if you have a kidney disease, it means that functioning of the kidney has been impaired. So the kidney is not able to filter the waste products from the body, which can help to maintain proper fluid balance in your system. So it's very, very, very important to keep your kidney healthy as much as possible. Because if this filter that has been given to us naturally is having some defects, it will be very, very difficult, as we said earlier, to treat this condition. Okay. So there are two main types of it. There are several types, but I just want to hint on the chronic kidney disease and the acute kidney injury. So for the chronic, it's more of a long term, and it's a gradual loss of the kidney function. So with modification, with lifestyle, dietary modification, medication, and some in the end, you can even do kidney transplants for them, or even dialysis. So that's the end stages. So we have stage 1, we have stage 2, we have stage 3A, stage 3B. We have stage 1, we have stage 2, we have stage 3, we have stage 3B, we have stage 4, we have stage 5. Okay. So depending on the stage or category of kidney problem that you're having, we have some specific diets we have to give to you. But because it's more personalized towards the clients, I can't give the exact diet in my presentation. Okay. But I can give a general overview of it. Then if you are at stage 5, that means that the strength of the kidney is almost there. That one, then you need dialysis for the body to be able to take the filth out of the blood. So you need a dialysis machine that will pass the blood through it. Then the wasteful substance will be taken out of it. Then you transfer it back to the body. Then for those who have money to, there's an option for kidney transplantation, but that's very, very, very expensive. So there's a need for us to protect our kidneys. Then you have the acute kidney injuries. So for that one, it's more sudden and it's very, very severe. So it can be caused by dehydration, infection, or underlying medical condition. So if that underlying condition is resolved, then it means that that kidney can be restored back into its original state. So it's just a matter of finding what caused the kidney injury and removing that thing from it. After doing that, the kidney will restore back to its original function. Unlike the chronic, that it will be with you for a very long time. So one may ask, what are my risk factors, or what's the likelihood of me getting kidney disease? So having these conditions doesn't mean that definitely you'll get kidney disease, but it means that if you have these conditions, you have to take care of yourself extra. You have to be extra careful so that you don't get this kidney disease. So diabetes is one of the risk factors, because you know that diabetes is a chronic hyperglycemia. That means diabetes is chronic hyperglycemia. So if you're having high levels of sugar in the blood, that means it's going to affect your nerves, and it's going to affect the nerves in the kidney, and that's going to cause your kidneys to be damaged. And obesity is almost a risk factor to almost every medical condition that I know of. So you don't have to be gaining weight to put extra pressure on the kidneys. And high blood pressure too is a risk factor. So if you're having high blood pressure, you have to be taking your medications how the doctor have taught you to take your medications, as well as if you're on a DASH diet, that means a dietary approach to stop hypertension. I'll talk more about that. You have to be following that diet strictly so that you don't go and increase the level of damage, or go and increase your risk of getting kidney disease. Then you have family history. So that if your family member is having this kidney disease, there's a likelihood, but it's not certain that definitely you also get some. Then age and lifestyle too are something that can also prone you into getting a kidney condition. So why is nutrition important? Because our topic today is why nutrition is important when in relation to kidney health. So if you're having a kidney problem, having the right amount of nourishment or healthy nutrition can help prevent you from producing excessive toxic or wasteful products. So already the kidney is stressed, you are having kidney condition, how the kidney filters the wasteful substances, that ability has come down. So we don't want to burden the nephrons or the kidney with extra waste. Okay, so eating healthy or eating very well is very, very, very important. Moreover, if you eat well, it also helps slow the progression of the kidney condition. So as I was talking about the stages of the kidney, chronic kidney disease, we have the stage 1, stage 2, stage 3. So if you are stage 1, if you're able to eat well, you will not progress to the stage 2. Okay, so it's very, very important for you to take your diet very, very, very judiciously. And moreover, if you are eating well or being well nourished, it can also prevent you from getting problems with dialysis. Okay, so even though you are on dialysis, it doesn't mean that you can eat anything that you want. You still have to eat well so that you don't put extra burden on your kidney. And also improves your ability to fight infection. So if you're able to do all these things, it means that you not spend much time at the hospital. It will help you to recover early. It will help you to recover early so that you can come home early and feel better. Okay. So taking very good care of your kidney is very, very important. And nutrition plays an important role. So one of the things about kidney disease is that protein management is very, very, very important. So this is for those who are having kidney problems. So eating too much protein can be problematic. And also taking too little protein can also lead to undernutrition. Okay. So there has to be a balance between the protein that you are taking and the kidney condition that you are having. So we have this specific lab that they do for those who are having kidney. We call it EGFR, which is the estimated glomerular filtration rate. So definitely, if you are having a kidney disease, the doctor requests for that lab. So depending on those labs, it will tell us the amount of protein that you have to take per day. Okay, so your dietitian will sit down with you and plan with you, depending on your EGFR, and help you know the amount of protein that you have to take per day. So let's say averagely, you are taking like 3 servings of protein a day. So when I talk about a serving of egg is one whole egg is 1 serving. 1 matchball size of meat, fish or chicken is 1 serving. Okay. So let's say you're taking like 3 servings of protein a day. It means that maybe in the morning you can take like 1 egg. In the afternoon, you can take like 1 matchball size of fish. In the evening, you can take like maybe half palm size of, or maybe 1 matchball size of meat in the evening. Okay. But the focus of the meat is the white meat. You don't want you to go in for the red meat. That's not ideal. That is very harmful to the body. That's going to produce extra waste, which is going to put burden on the kidneys. And you can also go in for the fish, but that one is very, very lean. You can also go in for the eggs. And in case you're going for dairy products, you want the low fat because, as we said earlier, obesity is a risk factor. So you don't want to put extra load or extra burden on the kidney. And sometimes, so I always say that you can't take care of a kidney problem without getting the labs. So you have to do your sodium labs, your potassium labs, your chloride, and other labs, especially for us to get the level of minerals in your body. Because most people overeat salt, and you know that if you take in too much salt, it's going to increase your blood pressure. And as we said earlier, hypertension is a risk factor or can also make your kidney condition worse. So the recommendation for taking salt a day is 1 teaspoon, which contains about 2,300 milligrams per day. That's for a normal person. So let's say you're having a kidney condition or you're having hypertension, you have to take half of a teaspoon. So that means that your requirement is even less. So you have to watch the amount of salt that you are taking. But even most of the time, it's not even the salt that you are consuming that's the problem. Because research has shown that 75% of the salt that people take comes from processed foods. So your canned fish, your canned foods, the biscuits that we take, the energy drink that we take, all those things contain sodium. And those foods are going to put extra burden on the kidneys. Okay. And the salted products, whole wheat, momoneka, whole beef, those things that have been salted, that one too can increase the sodium levels in our bodies. Then we also have to limit the takeaway food. Because the takeaway foods, they add a lot of artificial spices to it. And these artificial spices contain MAGs. If I say MAGs, it's monosodium glutamate. So it contains sodium. So if you're eating from outside, you are buying food from the food joints, it means that you are taking in too much sodium, which is going to put extra burden on the kidney. Okay. And as we always advise that after preparation of food, you don't need to add extra salt at the table. The one that you use for preparation is okay, it's enough for the food that you're taking. Even those who have restricted sodium, we always advise them that if you're preparing food, if you add salt to the soup or the stew, there's no need for you to add salt to maybe the bambu or the rice so that you limit the amount of salt that you are eating. Okay. Then potassium is also one of the labs that you have to watch out when you're having a kidney problem. Because potassium, although it's needed in the body, high levels and low levels are dangerous to the heart. So you have to maintain the levels of potassium in equilibrium. Okay. So what foods are rich in potassium? So we know of banana. Banana is very, very rich in potassium. But one of the food that usually we take it for granted is chocolate. Chocolate is very, 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 very high in potassium. So if you're having a kidney problem, or if you want to reduce the potassium that you are taking, then you have to watch out for the amount of chocolate that we are eating. Then the processed food, the fruit juices, and the cafe, that two are foods that are very high in potassium. You have to watch out. Okay. Then for phosphates, phosphate is very important to maintain strong bones and teeth. So high levels can weaken bones and damage the blood vessel. So chocolate, as I said earlier, is also very rich in phosphate as well. Then the cola brand, the Coca-Cola, the other brands that are having cola in, you don't have to take those products when you're having a kidney problem. Okay, as well as the nuts and seeds. But for the nuts and seeds, although they are healthy products, that one it will be dependent on the lab for the dietitian to know that you can take this nuts or we can't take that nuts. Okay, so we should take care of our kidneys and for us to maintain a healthy life. So phosphorus, for phosphorus, I don't really tackle much on the phosphorus because if you are having a kidney problem and you have seen a dietitian, definitely it's going to put you on a menu or a plan, a diet plan. So definitely the amount of meat or fish or chicken that you're taking has already been reduced. So the amount of phosphorus that you might take will not be that much. But still, you have to watch out for processed foods, sunflower and pumpkin seeds. Okay, those things are also very high in phosphorus. So if you are labs, so if you do the sodium or potassium labs and or phosphate labs and you are labs, the kidneys those levels are not high. They are not high in the body. Then there's no need for you to restrict these foods that I've mentioned earlier. Okay, but if they are high, that means that that particular lab that is high, foods that are rich in those labs, potassium, we have to restrict them. If the sodium levels are high, it means food that are rich in sodium, we have to restrict them. But if none of the labs are high, then we can plan and give you a normal healthy diet. But for the protein intake, as I said earlier, that one depends on this lab, DGFR, the estimated glomerular filtration rates. Okay. So these are the dietary recommendations for somebody who's having a kidney disease. So you have to choose and prepare foods with less salt and sodium. So you don't have to be adding artificial spices. Okay, then you have to be eating the right amount of protein. We recommended that most of them they have low albumin. So if you have low albumin, then you can go in for the egg whites. So if you boil 2 eggs, you can take the yolk out. Then you can eat the white part. Okay, so the 2 egg whites is equivalent to 1 egg. I hope you're getting me. Then you can choose food that are healthy for the heart. So we talk about the DASH diets. For the DASH diets, we want you to be taking whole grains, food that are not refined, food that have not removed the fiber out of the food. If you are preparing soups, you don't have to use colander or net to strain it to take out the fiber. We want you to take food that are very rich in fiber. Then if you are going for the oil, you don't want the saturated fats. If you talk about the saturated fats, those are the fats that are solid at room temperature. Okay, so the fat in the red meat, that one is not recommended. But something like olive oil and sunflower oil, you can go in for those ones. But even that, moderation is key. And chocolate drinks and other drinks on the market that have been processed, it's best you avoid those kind of products so that you can have the best of kidney health. So always know what your kidney health needs. And the labs can tell you what you have to do. So you should be monitoring your labs at least. I think 3 months is okay. You'll be checking your sodium, checking your potassium, and other kidney labs that you're supposed to do. Then you have to watch your plates. So the amount of food that you are taking is very, very important. You all have different weights. You all have different heights. So the amount of food differs. So let's say you are eating like a standard 2,000 kilocal diet. That means that you don't have to take a big plate. If you're taking something like maybe the medium orange size, 1.5 should be okay. Then you add a lot of soups and vegetable, soup or stew. If you are preparing the soup, a lot of soup or stew to it. Okay. Then for the meat side, you can go in for either the fish or the lean meat, or you can go in for poultry. Poultry is lean, rabbit is lean. Okay. But for the mutton, which is the sheep meat or the goat meat or the beef, you have to limit the intake of such products. In case once in a while you have to take those that kind of meat, you have to grill it so that most of the fats will be taken out of the meat. So this is a simple strategy that you can use to plan your diet as a kidney patient. So we have the 1, 2, 3, 4. It's like a 4-star diet. So one of the stars is from starch. The second star is from the fruits and vegetable. Then you have the animal protein and the plant protein. Okay, for the starch, we have rice. You can take millet, you can take sorghum, corn porridge, bread, pancake, almost everything. So far, it's a whole grain. You can go in for that one. Then you can be adding your fruit and vegetable to it. So for the fruit and vegetable, we didn't add banana, we didn't add oranges, we didn't add nkontomire because of the high phosphate levels in nkontomire, high potassium levels in banana and orange. Okay, so in case your potassium levels are restricted, then you can't go in for that. Okay, then for the animal protein, as I said, you go in for the egg, the fish, chicken, and the lean portions. And the plant protein, you can go in for almost all of them, but sometimes beans is restricted because of the potassium levels. So your dietitian will sit with you and plan with you, depending on the kind of labs that your kidney condition is preventing you from taking that kind of food. So your dietitian will plan that one with you. So let's say that you don't have a kidney condition. You don't have a kidney condition. You are fine. You are by God's grace, you are okay. But you want to prevent yourself from getting a kidney condition. What can you do? So I've listed about 7 things that you can do to prevent yourself from getting a kidney problem or for your kidneys to be healthy. So one, you have to stay hydrated. You have to stay hydrated. So let's take this scenario, for example. Whenever you are using a colander in the house and you are straining something from maybe you grinded some granite and want to strain it, definitely, the more you add more water, the more you're able to strain it. So if you want to remove toxic substance from the body, you have to stay hydrated. So the recommendation is that we take at least, so it means that you can take more than that, 8 glasses of water a day. A glass is like 250 ml. So when you take like a sachet of purified water, about 4 of them will give you the 8 glasses. Or when you take the 500 ml bottled water, about 4 of them will give you the 8 liters of water. Okay, so that's what you should do. You have to stay hydrated at all times. Then you have to eat a balanced diet. So this is how you go about your balanced diet. So this is a pyramid. So you can look at the base. So the base is more of the whole grains. The base is more of the whole grains. So the maize, if you're taking bread, the wheat bread, that one is better. Okay. If you're taking rice, I'm going for the local rice. If that one is not available, when you take your refined rice or the polished rice, you have to add a lot of vegetables to it. So the next stage on the pyramid is the vegetables as well as fruits. Okay. So unlike the vegetables, although they are very, very good in minerals and vitamins, it doesn't contain a lot of simple sugars. But the fruits also contain a lot of simple sugars. So for those who are having diabetes, the amount of fruits that you are taking is very, very important. So maybe you can take like maybe 2 servings of fruit a day. So a serving is like 1 banana. So maybe you're taking banana for the whole day, means like I can take only 2 bananas for the whole day. If you want to take like pineapple, then you have to divide the pineapple into 4 and take 1 of them. 8 for watermelon, it means you have to take 1/8 of it. Okay, so if you're taking the fruit, the amount is very, very important because the fruit are containing simple sugars. If you eat too much, it's going to increase your blood sugars. And that one is also going to affect your kidneys. But for the vegetables, because it don't contain a lot of carbs, that one is more healthier. Even if you take a large amount, it's fine. Unless maybe you have been restricted on something like contomere or the other green vegetable because of the phosphate or the phosphorus or potassium levels. That one, they then have to restrict. But we even give you other alternatives that you can go in for. Carrot is there. You can use the onions and other ones to prepare your soups. It's fine. You can use the garden eggs. Okay. Then for the next level, we have the meats and the meat products. That one, we need them in some limited amount in the body. So you can go in for the low fat milk, the skim milk. Okay. Then for the meat, you can go in for the poultry first, the fish, the eggs. In case you have to take the red meat, that means that we have to grill it so that most of the fat will be taken out. Then you have the oils and the sweets. That one, it should be as minimum as possible. It should be as minimum as possible. So whenever you are preparing something like a kututu, as I'm preparing it, you just add about maybe a dessert spoon of palm oil to it. rather than adding all the oil that you have fried on fire onto the food. That one, after eating, you're going to take a lot of oil into the body. An example, if you're taking like palm nut soup, granule soup, you have to take all the fat, the oil out of the soup that you are preparing so that you reduce the amount of oil that you are taking into the body. Because you don't want to be taking a lot of calories that is going to put extra weight or it's going to help you gain extra weight. That's going to put burden on the kidney. So if you want to achieve a healthy kidney, then you have to follow this pyramid. Okay. Then for the next one is alcohol intake. So personally, even WHO recommends that if you can stop taking alcohol, that is the best. That is the ideal way. If you can stop, that is the best. But if you think, oh, me, I can't stop taking alcohol, then fine. So this is the recommendation, 14 minutes a week. So if I talk about the units of alcohol, if you take the beer, the small beer, half of it is a unit, okay? Or the one that they call tots, that one, the strong alcohols, more than 4%, that one is a unit. So if you're taking alcohol, it means I can't go beyond that amount of alcohol within a week. So both men and women, if you can stop alcohol intake, fine. But in case you want to take some, this is the recommendation. Then we have smoking. For smoking, whether it's shisha or any kind of smoke, stop. There's no recommendation for the amount of smoke that you can take into your body. It's just not healthy. You have to quit smoking. You have to stop smoking. If you are finding it difficult to stop, see a psychologist so that he can help you, or go for rehabilitation so that you can stop the kind of cigarettes or the kind of habit that you are in. So for smoking, there is no recommendation. The best way to go about this is to split or stop smoking. Then you have to maintain or manage your blood pressure. So usually the best BP is around the systolic. I mean the top number is less than 120 milligrams per mercury. Then the diastolic is like less than 80 milligrams per mercury. So if your BP is about less than 120 over 80, then you are fine. Okay. So you have to be checking your blood pressure regularly. Because for the blood pressure, it's not something that you can see, okay, unless you check with the SFAG. That's when you know your blood pressure. Then for the dietary aspect, if you're on a DASH diet too, you have to take that diet very, 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 very importantly. Because if you skip the meals, if you eat anyhow, if you eat whatever you want, you are putting extra burden on the kidney. So definitely, if care is not taken, you're going to develop a kidney disease, and we want to prevent that. Then the blood sugars as well. So since maybe you're not going to the hospital regularly, it's recommended that maybe you can do the HbA1c. HbA1c is a type of blood test that you can do so that you know the amount of sugar levels your body is having for the past 3 months. So that one gives a better reading, or it gives a better understanding of how your sugar levels have been for the past 3 months. If you don't have that one, you can use the normal glucometer to do the FBS, which the normal range is around 4.0 to 5.6 millimole per liter. If it's high, then you have to see a dietitian for counseling so that it can put you on a diet. So one of the diets that can increase your sugar levels, like diets with low fiber or refined carbohydrates. Okay, so sugars, has a cocoa, that one that they have strained it, so they're taking all the fiber out. Okay, and chesra, kappa, those food that they are taking all the fiber out can have that risk of getting high blood sugar levels. Okay, but usually if you are healthy, your body is able to correct that. But those who are having diabetes, then we really, really, really have to watch the amount of fiber that you're taking. If the fiber content of the food is low, then you have to watch that out and eat foods that contains a lot of fiber. So for the breakfast options, you have oats, we have Tom Brown, we have wheat. All those ones are very, very rich and high in fiber. But if you're going for the ayukoko, that one that they are strained, that one is low in fiber. For the bread option, the white bread, or the thin bread, or the butter bread, those ones, you don't have any fiber inside. Okay, so you can go in for the oats, the whole grain bread. That one is recommended. So whenever you are eating, ask yourself, is this food going to increase my sugar levels, or is it going to help me maintain an optimum blood sugar? And the one that is going to help you maintain an optimum blood sugar and the foods that are very rich in fiber. And the vegetables are doing well in that category. They can help you maintain a very good blood sugars because they are very, very, very rich in fiber. Then we cannot never omit exercise. So the recommendation is that we exercise at least 150 minutes a week. So you can decide whether you can do 30 minutes every day of brisk walking, jogging, or whatever exercise that you think you can do. So if you also want to do like 45 minutes 3 times a week, you can do it like Monday, Wednesday, and Friday. Okay, so that at least there can be 1 day interval in between the exercise that you are doing. Then you also have to maintain a regular checkup, because if you don't check up your BP, if you don't check up your sugars, you will not know what is happening in your body. You will not know whether you have to be extra careful, or you will not know whether something is wrong. Something wrong is somewhere. Because if you check your blood sugars and you see that your EGFR is coming down, then it means that a kidney problem is being developed. Then you can quickly take the appropriate intervention, so that in case we can correct it, than wait till you get to the end stage renal condition that we cannot do anything about it, rather than maybe dialysis or what, kidney transplants. Okay. Then maybe for every 6 months, you can try and check your HbA1c to know how your blood sugars have been. So that one, first you can do it every 3 months, but maybe because of monetary issue, you can do like every 6 months. Okay. But at least, if not for anything, at least once in a year, go for regular checkup for them to know what is happening in your body. So in conclusion, kidney disease is very, very, very serious, as I have listed earlier. And we have to take our health into our hands. We have to eat well. We have to go for regular checkups so that we can detect whether we are having any problems with our kidneys, so that we can prevent it and from getting to the end stage renal disease. Because as we're introducing this lesson, we said that dialysis last year was very, very expensive. It's even now that we have added to the health insurance, but that does not mean that you can just go about eating anyhow, hoping that you can be on dialysis. It's not something easy to be on. So if you can prevent yourself from getting a kidney disease, that's the best way to go about it. So maintaining a well-balanced diet tailored to your need is very, very essential to supporting kidney health and overall well-being. So as I always say, if you don't take care of your body, where will we live? Because your body is the only thing that you have. So if you don't take care of the body that you're having, where are you going to live? So thank you very much for your time and attention. So if you have any questions or contributions, you can ask me. Thank you.
Right, RD, thank you so much. Thank you so much. I really like the last sentence you said. If you don't take good care of your body, where would you live? That's a very profound statement. Thank you so much for such an insightful discussion. I have also learned one or two things. Thank you very much. God bless you. Please we can now, if you have any question, if you want to unmute and say it, you can unmute and say it, or if you would want to type it, please type it in the chat box and Audi will address it. So please, Audi is ready for our questions. So please, let's keep them coming.
Hello, Audi, thank you very much for the education. Very, very, very powerful. I have a question. It's not really a question, but I would want RD to talk a little bit more on the artificial spice. How dangerous is it? Because I've heard a nutritionist say that, a dietitian say that it takes, when you take those artificial spices, it takes about 3 days before it gets out of your body. So can you elaborate more on it for us?
Okay, so for the artificial spices, I don't really know how long it's able to flash out from the body for the system. I can't really tell the exact number of days. Okay, but one thing is that the sodium glutamate, one, it makes you eat a lot. That's one thing about it. It makes you eat a lot unconsciously. So you will find out that food that they are prepared with MAGs or the artificial, you tend to eat more than the one that are not prepared naturally. And secondly, because of the sodium levels in the MAGs, you are at risk of increasing your blood pressure. And as I said earlier, if your blood pressures are increased for a very long time, that's going to put pressure on the vessels of the kidney, and that's going to end up with a kidney disease. So this is how serious it is, because it's going to exacerbate, or we're going to increase the blood pressure that the client or you are having. So it's best we avoid the artificial spices as much as possible. And the one that they sell outside, I think they said they use some white kind of maggi. I've not really gotten a chance to see how it looks like. But that one, I think it's having other ingredients, or it's having other substances that you don't even know, which can even prone you into even getting cancer. Okay, so it's best you prepare your food from the house. You don't add in any artificial spices. That is the best way and the most healthy way to go. Thank you very much.
Thank you, RD.
RD, please, there was a question in the chat box. Please, should I read it out, or you would want to?
If you can read it out, I'll be grateful.
Okay. So the person is asking if okay. So the question is, does the blood group count in the food to eat, resulting in the kidney issue? I mean, if you are A positive or O, are there any particular food to take to prevent kidney diseases?
Okay, so for the blood group diet, I think a lot of dietitians have talked about it. Okay, so whether it's a kidney problem, it's diabetes, it's hypertension, the blood group diet is lacking scientific support. Okay, so usually before you can bring something out as this one is an evidence for you to use it in teaching people, it has to be performed in certain areas or in different localities for you to know that what this person is saying is very, very true. But for the blood group diet, that one is lacking robust scientific support. So we can't use the blood group diet in saying that in case you are having blood group O and it maybe maize, your risk of getting kidney condition is high. That one is not true. Okay, so as the scientific community stands now, the blood group diet is not something that we can use. So the things that I said, if you're having potassium issue, maybe you have to restrict banana. If you're having phosphate issue, you have to restrict chocolate. For that one is more scientific. But for the blood group, whether you are O or B or AB, you still have to follow the general kidney diet plan. Okay, there's no special diet for any kind of blood group. Thank you very much.
Right. Thank you very much, RD. And I think the blood group diet is something that has, over the years, it looks like it has been registered in the minds of people. And it's so unfortunate that sometimes, even in our hospitals, from even healthcare professionals, they are even advocating for that. And thank you for clarifying that it's not scientific based. And to anybody on this line right now, this is something we can really take home and really tell people around us, that the blood group diet is not scientific. There is no clinical trial or any research that has been done on it to ascertain its usefulness. So please let's be mindful of that.
Thank you very much.
Thank you very much, Audi. We are still waiting for questions. So please, if you have any question, any clarification, please feel free to ask. Okay, Audi, please, someone has sent a question.
Okay, so
someone is saying, someone is saying that. Sorry, Audi, sorry. Please, can I go ahead?
Yes, please.
Okay, so the person is asking if he or she can just walk to the hospital and request for a lab test on the kidney.
Oh, okay, so for the lab test, not even a hospital, you can walk into any lab. We have, I mean, we have Lancet, we have Medilab, we have big labs. So I think Lancet is the most popular one, and Medilab too is fine. Medilab's at Confanoche, opposite Confanoche. I think Lancet too have branches all over the country, so you can just walk to any lab and request for kidney labs. Okay, but we can be specific. We have the RFT, renal function test. That's the name of the lab. So that's going to give you your creatinine levels and your urea levels. Okay, so you can request for the RFT RFT, renal function test. And if you want to know how your liver stool or the protein levels also are, then you can also do the liver function test. That's the LFT, liver function test. Okay. Then you can also, if you want to know the function or the filtration rate of your kidney, then you can also do the EGFR, the estimated glomerular filtration rate. So I'll type them in the chat box so that if you want to copy, you can copy it. Okay. Then if you want to also do the electrolyte like the potassium, the sodium, and potassium, you can request for it. So I'm typing them right now so that in case you want to copy them and go for a kidney test, that one too is an option that we can do. Okay.
Right. Thank you so much, RD. There is another question. So somebody wants to know if you can recommend a good natural spice in the market.
Okay. So for us, it has been packaged. It's not natural. Let me put it that way. Because if it's packaged, the pet is an industry, okay, and no industry wants to run at a loss. So far the person has packaged it, the food science will say that there are preservatives as part of that packaging. So if that product can last for maybe 1 year or 2 years. And most of the time, one of the preservatives that they use is the sodium. So if it has been packaged, it means that it's not natural. So if you want to use the natural spices, then you're using our onions, you are using our garlic, the natural ones, the fresh ones. Okay, you're using the pepper and the nutmeg, the natural ones. But if it's in the paper or it's in the sachet, it means that it has been processed a little for it to last long on the shelf. Thank you very much.
Thank you to RD. And just a little to add to what RD is saying. Just like RD is saying, I think the other thing that would help us is to read the food labels. Mostly when you buy a product or anything, when you look at the ingredients, look at the labels. Some of them, when you read the food labels, you'll be able to point out these additives. You are not so sure of the particular substance. You can just Google the particular substance just to be sure, right? Because there are a lot of, I think right now the awareness of the artificial spice has really gone out and the public has really accepted. So I think now there are some brands that are trying to make some natural spice but packaging it. But just as I already said, let's be mindful of that. So one of the ways to identify it is by reading the food label. Read and be sure you know the substance in the food. If you are not so sure, you can just ask a dietitian or just Google the particular substance just to be sure it's a natural source and not an additive. Thank you very much.
And I don't know whether you have done it already. I was recommending that maybe another day you can have a session of how to read food labels.
Yes, Ari. Yes, Ari. Thank you very much for the suggestion. We will take that into consideration. Thank you very much. And Ari, please, someone wants to ask if you can address why a kidney transplant patient is not allowed to consume raw foods and why renal patients are not allowed to consume green vegetables.
Okay, so as I was saying earlier, you have two kidneys, okay? So the two kidneys are helping to take out the toxic or the wasteful products from your system. So if you have a kidney, it means that you are living on one kidney. So the rate or the strength at which the kidney is able to take out wasteful substances or remove some of the minerals from the body, that mechanism has been impaired or has been reduced, or the integrity has come down. So in case you have done the liver transplant, the green leafy vegetables, in containment, those things, as I said earlier, those are rich in potassium, phosphate, and those things. So we don't want you to put extra burden on the kidney. That's why we recommend that you don't take in green leafy vegetables. And moreover, for the raw foods, like the whole grains, usually is at the fiber part that those minerals are. And that's why those raw foods, they counsel that you can avoid them for some time. But in case after for some time, they do the kidney labs or they do the potassium, the sodium, and the other electrolytes, and you are fine, then your dietitian might or may allow you to take some amount of such products. But before that, you have to restrict them. Okay, so that's why it's not allowed for renal patients to take in green leafy vegetables.
Right. Thank you very much. Another question is here. So the person is asking if I take heavy meals like fufu or banku early in the morning instead of porridge or tea, are there any negative implications?
Okay, so this is about healthy diets in general. So for the eating heavy meals in the morning, I think it's more of the kind of work that you do. Personally, I recommend that you eat your most heaviest meal in the morning because most of us, we are more active during the day. You eat and you go to work, okay? And for example, somebody who is amazing, somebody who is very, very active during the day, everybody going to take like porridge in the morning, definitely. Everybody not going to do well at the workplace because the amount of energy that the person has consumed is not enough. So if you eat your banku in the morning, there is absolutely nothing wrong with it. If you think you are very, very sedentary, especially in the evening, personally, I recommend that you eat your rice, your banku, and those things in the morning, so that in the evening you can take your porridges or the light foods in the evening. That will be much better than eating heavy meals in the evening or at night.
Thank you very much. So, Audi, please, someone wants to know if kidney disease is related to genetics. Hello, Audi. So the person wants to know if there is a genetic relation with kidney disease.
Okay. So for kidney disease, there's some types of kidney disease that is related to genetics. Okay. But most of the time, the CKDs and the acute kidney disease that is usually common in our setting, those ones are not directly linked or directly inherited from the parents. Okay. So there's some bit of family history there, but it's not definite that if your mother or father is having kidney problem, you are going to have kidney conditions. But there's some type of kidney conditions like the polycystic kidney disease that can be linked to genetics or is hereditary, but not all of them. Hello, I hope it's clear.
Very much. Yes, please, it is. It is. Thank you very much. Please, are there any other questions you would want Audi to address? And Audi has sent us the various liver function tests and the renal function test. So you might want to look at the chat box to get that. And it's very recommended that we check our liver function at least once a year, so you have an idea of how your liver is working. Okay, so Audi, please, someone just sent a question and he's asking, what are the dietary recommendations that would be good for a chronic kidney disease patient?
I think I've talked about that one earlier.
Yeah.
So as I was saying earlier, for a chronic kidney disease, you can't counsel the clients without the labs. Because some of them, they come with their sodium high. Some of them, the potassium levels are high, but the sodium is okay. So depending on the kind of, the type of labs that is very high, it means that you have to restrict foods that are rich in those particular minerals. Do you get the point? So if the person is maybe CKD, you have stage 1, stage 2, stage 3, stage 4. For stage 1, maybe you can take maybe 1 gram of protein per your kilogram body weight. For that one, maybe you can eat more protein than somebody who is having end-stage renal condition without dialysis. Okay, so without getting the actual labs, it's very difficult for me to say that go and eat this, go and eat that. But as I gave the general presentation, if sodium is restricted, then you have to make sure you eat foods that are low in sodium. So we give options here about not using the substitute, not buying food outside because of the MSGs that we talked about earlier, and not be using processed foods as well as energy drinks. Then also say that when potassium is restricted, you don't have to be taking coconut water, banana, oranges, and foods that are rich in what? Potassium. Then we talk about the phosphate, that foods like chocolate is very, very, very high in phosphate, and cola, Coca-Cola, those cola drinks. Those ones are very, very high in phosphate. So depending on the kind of labs that are high in the blood, that are high, the numbers that are high, those are the ones that we restrict. But in all the kidney conditions, one thing that comes across is that the amount of protein that you are taking will be reduced so that you don't produce excess waste that will put pressure on the kidney. Thank you very much.
Thank you very much, RD. Thank you so much. And okay, thank you very much. And thank you, RD. I believe we can close for the day. We are so grateful for your time and I know you are a very busy person. So thank you so much for taking time off your busy schedule to do this with us. And I believe we have been well informed when it comes to kidney health. And I would end by saying that we all need to see a dietitian, irrespective of who you are, whether you think you are healthy, you don't have any disease. We all need a dietitian. Everyone needs a dietitian. And more importantly, it would be best you don't make decisions when it comes to your nutrition from Google or from your own analogy or from hearsays. It's better you see a dietitian, then the dietitian can better help you, because during Audi's presentation, he said emphatically that every dietary recommendation is individualistic. It's based on the person's presenting complaints. So someone's recommendation might be different from yours. If we take a group of people that they all have kidney disease, even if it's the same diagnosis, there is no way their nutrition intervention will be the same. There will be some difference. So this is just a word of advice to all of us to kindly make time and see a dietitian. Somebody has never seen a dietitian before. It's bad. I don't know if we have to. I don't know what else we can say to let people know the importance of seeing a dietitian. So just to help you, there is a dietitian at the wellness center. So you can just come to the wellness center anytime in the day from Monday to Friday, and there is a dietitian at the wellness center to attend to you. So please, let's make good use of the opportunity that is right at our doorstep, and let's get the best out and help us for our nutritional health in that regard. So make a date with us same time next month for another fruitful discussion on nutrition and heart health. We just treated kidney health, and we want to look at heart health. Let's make time and join. Do well to invite somebody. The date and the time will be communicated to us as we do always. Thank you so much for honoring our invitation for this afternoon, and I believe you have learned a lot. So we will close with a closing prayer for Mrs. Abigail Kwate.
Okay, can we pray? Dear Lord and Master Jesus, we're grateful. We thank you for how far you brought us. We are grateful for the words, the education we've had today. Father, now that we have heard this, help us to be doers. Help us to put it into practice. Holy Spirit, remind us each and every day. And at the end, we'll be grateful unto your name. Amen.
Amen. Once again, we are so grateful you joined us this afternoon. And please make a date with us next month as we treat nutrition and heart health. Thank you so much. Enjoy your day. Bye.
Bye. Thank you.